So to continue my last mini lecture or presentation few moments ago, and sorry for interruption, I was talking about the different functions of the liver, and I already talked about the synthetic functions of the liver, the storage functions of the liver, and then the metabolic and excretory functions of the liver, and I talked about other functions, including the endocrine functions of the liver, and the liver as a moderator in many hormonal and endocrine processes inside the body. So consequently, from here, as a basis to understand the physiology of the liver and the biochemistry of the liver, we have to go to the clinical manifestations of liver disease. So when the liver is affected by any disease process or any pathological process, including, as I mentioned, inflammatory, infectious, neoplastic, vascular, autoimmune, or metabolic causes, or even in genetic syndromes involving or hereditary disease involving the liver, any pathological process in the liver, whether it is genetic or acquired, it will produce certain manifestations as regards of or as a consequence of disturbing the physiological functions and the biochemical functions and the biochemical reactions which happen in the liver. So it might present with either local manifestations or general or systemic manifestations. Among the most common local manifestations are abdominal swelling or hepatic swelling or hepatomegaly. So hepatomegaly is a presentation of liver disease, abdominal swelling due to enlarged liver or as a result of ascites in patients with chronic liver disease and the chronic liver cell failure. There will be ascites as well as, of course, to peripheral edema in the ankles, ankle edema, and in severe cases, terminal case, we get anasarca, which is edema affecting the whole body, not only localized to the periphery or to the abdomen in the peritoneum. That's ascites. It will be edema everywhere in the around the heart, in the pericardium, in the pleural space, that is pleural effusion, precordial effusion, peritoneal effusion, that is ascites, peripheral edema, edema of the legs, edema of the hands, edema of the face. The whole body is edematous. There is water in the whole body due to liver cell failure. As we all know, hepatic failure is one of the causes of peripheral edema or generalized edema. So edema is another presentation as a general feature. Or local edema in the abdomen, that is in the belly, what we call ascites, causing generalized abdominal swelling, is a presentation. It is a local manifestation of liver disease. Also, there may be splenomegaly due to portal hypertension if the chronic liver disease caused portal hypertension. Patients with chronic hepatitis proceeding or progressing to liver cirrhosis, one of its common complications is portal hypertension as well as liver cell failure. We all know that these are the two end results of any chronic liver disease, the portal hypertension and the chronic liver cell failure. Or chronic hepatocellular failure. So portal hypertension will help in the localization of edema causing ascites, and also will cause enlargement of the spleen, or what we call splenomegaly. So splenomegaly might be a manifestation of liver disease. Ascites is a manifestation of liver disease. Enlarged liver, of course, number one, will be a manifestation of liver disease. And then we come to general features of or general manifestations, general symptoms and signs pointing to liver disease, including, as I mentioned, to ankle edema, edema anywhere in the body. Also skin manifestations, as I mentioned, skin manifestations, spider nevi, jaundice, pallor. We all know that anemia is a presentation of chronic liver disease. We call anemia of chronic disease. So it might disturb the hematological system. Also, it might cause platelet abnormalities. So there will be bleeding tendency. It will also cause coagulation abnormalities due to deficient vitamin K in patients with chronic liver disease. So there might be coagulation abnormalities leading to abnormal bleeding. Also, there are chronic infections due to abnormalities in the white blood cells due to toxic effects of toxic metabolites on the bone marrow. So anemia, bleeding tendency, coagulopathy, especially in patients, that's DIC, or disseminated intravascular coagulopathy, or hemostatic failure, especially in patients with fulminant hepatic failure, acute hepatic failure, and this is an acute hepatic disease or acute hepatic presentation, for example, complicating alcoholic hepatitis or acute viral hepatitis, or acute exacerbation in some metabolic liver disease like in Wilson's disease and rarely in hemochromatosis. So these are all hematological, endocrine, skin, joint, even manifestations in patients with chronic liver disease. Also, the effects of liver disease on the gastrointestinal tract, on the gut, including nausea, vomiting, anorexia, diarrhea, constipation. These are all secondary effects of liver disease on the gut or on the gastrointestinal tract, and of course gastrointestinal bleeding also due to portal hypertension, as I mentioned before, due to esophageal varices or gastroesophageal varices in patients, especially in patients with hepatic fibrosis, and this is more common in hepatic fibrosis rather than cirrhosis, like in bilharzia hepatic disease, for example. So portal hypertension is more common in bilharzia hepatic disease, while liver cell failure is more common in alcoholic liver disease. So the bleeding might be presentation, whether bleeding in the skin or hemostatic failure, or local bleeding from the gut due to portal hypertension, complicated by esophageal or gastroesophageal varices and rupture of the varices producing upper and then lower gastrointestinal bleeding. These are all presentations of liver disease. So we have to remember that we have to make our liver happy. We have to be careful here. Al-waqaya khayrun min al-ilaj. Prevention is more important than cure. How to keep our liver happy, how to keep our liver healthy. Number one is by having what we call liver-friendly diet. Liver-friendly diet, that is healthy, well-balanced diet. Healthy, well-balanced diet is the key advice for a healthy liver, a liver without disease, a healthy liver. Number one, healthy diet. The more you have a healthy diet, the more your liver will be healthy, and the more your kidney will be healthy, and the more your brain will be healthy, and the more your cardiovascular system, including the heart, will be healthy, and the more your all body and mind and status will be healthy. So here you have to have what we call a well-balanced, healthy diet. And the healthy diet is a well-balanced diet. That's why you have to have a good, stylish, wise eating behavior. The most important is to focus on vegetables and proteins. Vegetables and proteins provide the liver with antioxidants and with detoxifiers, which clears the liver from any toxins and keeps the liver healthy. This is what we call focus on foods containing antioxidants and detoxifying substances. And these usually are lying in the vitamins and trace elements. Vitamins and trace elements, which act as antioxidants and protect the liver from any damage and keep the liver always healthy. And this is what we call liver-friendly foods and liver-friendly diet. That the diet which is friendly with the liver and keeps your liver healthy and keeps your liver happy. Vegetables and fruits. Again, I repeat, vegetables and fruits, especially greens, greeny vegetables, leafy greeny vegetables, garlic, ginger, some spices like turmeric, like ginger. This keeps the liver healthy. As I mentioned, garlic is very important. Lemon is very important detoxifier, and this is a fruit, citrus fruit. So citrus fruit, especially lemon, vegetables, especially garlic, and spice, especially turmeric and ginger. They are detoxifiers to the liver, and they keep the liver healthy and detoxify the liver, and even if any deposits of fat, they will clear the liver from fats and prevent what we call fatty liver disease, or the steatohepatitis and steatohepatosis, or the NAFLD, or non-alcoholic fatty liver disease, with all its scope, which might progress to steatohepatitis, and even it can progress, if not treated, can progress to some form of hepatic cirrhosis or liver cirrhosis in advanced cases. So you have to have a healthy diet. Healthy diet is the key for healthy liver and a happy liver. Also, to avoid substances which might be toxic to the liver and irritate the liver, like too much sugars, too much sweets, too much cholesterol, fried foods. You should avoid such kind of toxins to the liver. Sweets and fried fruits and fats, or cholesterol containing, especially saturated fats containing foods. They are dangerous to the liver. They are toxic to the liver. They enhance the development and the progression of what we call fatty liver disease. So we should avoid such foods. Again, should avoid sweets, should avoid oils and oily foods and fried fruits. Keep away from such dangerous foods to the liver, and focus more, again I repeat, on vegetables and fruits and high fiber foods and cereals and grains, which keep your liver healthy. And try to avoid some bad habits also, like alcohol. Avoid alcohol, because alcohol damages the liver. Alcohol is is responsible for most of the liver disease in the Western world. Alcohol affects, in fact, many organs in the body. Alcohol affects the liver, alcohol affects the heart, alcohol affects the brain, alcohol affects the reproductive system and sex. Alcohol affects the endocrine function. Alcohol affects the heart, as I mentioned. Alcohol, number one, affects the liver. So to avoid liver disease, get away from alcohol. Alcohol is a potential toxin to the liver, causing alcoholic liver disease with all its spectrum, starting from fatty liver to alcoholic hepatitis, acute alcoholic hepatitis, chronic alcoholic hepatitis, alcoholic liver cirrhosis, and then ultimately the end is hepatocellular carcinoma, which is liver cancer. So this starts from alcohol, alcohol, as I mentioned. So keep away from alcohol. Avoid alcohol, avoid too much smoking, avoid toxins and substances which might be dangerous, like dopers used by bodybuilders, and substances which help to build skeletal muscles. If taken without medical advice, they affect the liver, and also they are toxins to the liver. All drugs are potentially toxins. Don't take drugs without medical supervision or without medical advice, because they are potential toxins, as I mentioned. The liver deals with all drugs and is responsible for the metabolism and the excretion of drugs. So be careful from any chemical or drug or anything you take it by your mouth or by any means to enter inside your body. It will be taken by the liver. It might insult the liver. It might hurt the liver. It might start a liver pathology. So keep away from drugs and other substances without medical advice. Don't take drugs without medical advice. Dangerous to the liver, dangerous to the kidney. So avoid such substances. So avoid toxic substances, avoid alcohol, avoid foods which are dangerous to the liver, especially sweets and fats. Focus on foods containing antioxidants and detoxifiers, like green foods, like vegetables, like greeny leafy vegetables, like fruits, like cereals and the grains. These are all keep your liver healthy and keep your liver happy. Don't forget to keep your liver happy. Keep your brain happy, keep your liver happy by having a happy food, by having what we call liver-friendly diet and liver-friendly foods, and avoiding the dangerous bad habits, including drinking alcohols, including wine and whiskey and vodka and all these different types of wines which affect the liver. Keep away from wine, keep away from alcohol, keep away from dangerous substances, keep away from consuming drugs and abusing drugs without medical advice and against medical advice, because they are dangerous to you, and have a balanced, well-balanced, healthy diet. This will keep your healthy liver, and at least it will avoid 2/3 of the underlying causes of liver disease, and in other varieties of causative agents or other causes of liver disease like viruses. These are things which is outside of your scope, and then we can come to manage the other causes of liver disease, like infectious causes, viral hepatitis, or neoplastic causes like liver tumors and hepatic cancer. Because also many of such foods and abnormal substances, they might be carcinogenic. So they help directly or indirectly in the pathogenesis of neoplastic liver disease. So keep your liver happy, have a liver-friendly food, have a liver-friendly diet, and keep your liver always healthy. These are the manifestations of liver disease which I mentioned. The local manifestations, the most common is hepatomegaly, abdominal swelling, jaundice, ankle edema, abnormalities in the skin, abnormalities in the general health, like easy fatigability, like general weakness, like effort intolerance. These are general non-specific manifestations of liver disease. Also general features due to the metabolic effects of the liver disease on the body, on the brain, on the cardiovascular system, on the endocrine system, on the hemopoietic system. These are all general manifestations of liver disease. Jaundice, and then after that, other than the local manifestations in the abdomen pointing to liver disease and the general manifestations in the body pointing to liver disease, we might also have another third presentation, which is abnormalities in the blood tests. That most common is abnormal liver function test profile. LFT is abnormal. For example, high liver enzymes point to a liver disease, like high AST, high ALT, high alkaline phosphatase, ALP, high 5-nucleotidase, high gamma-glutamyl trans-GTT. These point to also to liver disease. High bilirubin, hepatobiliary disease. So abnormalities in the liver function test, or other laboratories abnormalities like abnormalities in the blood picture. The CBC, the liver disease may cause pancytopenia. Liver disease may show picture of anemia in the CBC. Liver disease may show platelet abnormalities in the CBC, or in the platelet function tests, or in the platelet number, or maybe pancytopenia if in DIC, complicating acute liver failure. In acute hepatitis, what we call acute liver failure or fulminant hepatic failure, they might produce abnormalities in the blood. Also, they might produce abnormalities in the other chemistry, like low albumin, hypoalbuminemia, high globulins, because globulins, they are metabolized in the liver, and since the liver is deranged or damaged, they will be retained in the blood, and there will be hyperglobulinemia. So abnormalities in the plasma proteins, abnormalities in the blood count, in the RBCs, in the white BCs, in the platelets, these are all secondary effects of abnormal liver and liver disease on other body systems. This is different possible presentations of liver disease. Thank you so much, Professor Tarek Ali.